My name is Brionna Wicks, a Master's of Public Health Researcher within the Department of Community Health and Preventative Medicine and Morehouse School of Medicine, and my XULA poster focuses on influence of age and pleasure on risk reduction behaviors in Black women. Black or African American women remain at high risk for HIV. PrEP uptake is a key prevention strategy in the CDC's Ending the HIV Epidemic in the U.S. initiative, which seeks a 75% reduction in new HIV infections by 2025 and a 90% reduction by 2030. African American women are one of the priority populations for PrEP uptake due to the disproportionate impact of HIV and AIDS. The Ending the HIV Epidemic has selected priority jurisdictions for the implementation of key strategies. The 4 counties in Georgia outlined in this jurisdiction are Cobb, DeKalb, Fulton, and Gwinnett, while the state of Kentucky is also a priority jurisdiction. The Pro Sisters Project looked to focus on African American adult women at risk for HIV in geographic hotspots in Georgia and Kentucky. A community-based participatory research approach was used to formulate a baseline survey for the project with questions focusing on PrEP intent, condom use, risk reduction, and HIV knowledge, to name a few. To be eligible to participate in the study, you had to currently live in Gwinnett, Cobb, Fulton, or DeKalb County in Georgia, and for Kentucky, you had to live in Jefferson County or Louisville. You had to be 18 years or older, willing to participate in a one-time survey, sexually active within the past 3 months, not pregnant or planning to be pregnant in the next 6 months, a Black or African American woman, and someone who has not participated in a previous HIV intervention. The purpose of this particular research study within the Pro Sisters Project looked to examine if, by age, does sexual pleasure influence risk reduction behaviors of African American women in a region with high rates of HIV. The baseline survey was collected from 164 cisgender women in Georgia and Kentucky who have had sexual intercourse in the past 3 months. Dissemination was done via electronic and paper survey. The survey assessed risk reduction behaviors such as the likelihood to take PrEP, condom use with a partner in the past 3 months, and the number of sexual partners, 1 or less versus more than 1. Data was collected via Qualtrics and analyzed using SPSS. A binary logistic regression model examined associations between age, sexual satisfaction, and 3 sexual risk reduction behaviors. Older women were significantly less likely than younger women to report PrEP willingness. Age and sexual satisfaction, however, did not significantly predict condom use. And sexual satisfaction significantly predicted the number of partners, with moderately and very satisfied women showing higher odds of reporting 1 or no partners compared to less satisfied women. We divided our age groups into 2, 18 to 49 and 50 and above. In conclusion, the findings show a complex relationship between risk reduction and sexual practices. Age and sexual pleasure did not influence condom use, although women 50 and above had low intent to take PrEP. With age/satisfaction not influencing condom use, the need for peer-led interventions is necessary to address interpersonal, community, and socio-political factors shaping ideas around risk reduction behaviors and their benefit for the population at risk. Here are my references. My acknowledgments. I'd like to take this time to acknowledge the participants within the Cobb, DeKalb, Fulton, Gwinnett, and Kentucky counties, the Pro Sisters research team at the University of Kentucky, and the funding for our study. Thank you.